Ever wondered if there's a downside to steroid use beyond the well-known physical side effects? Steroids, especially anabolic-androgenic steroids, are synthetic variations of the male hormone testosterone. They're widely used by athletes and bodybuilders to enhance physical performance and muscle mass. But like any powerful tool, they come with their share of potential side effects. Most people are aware of the physical dangers: liver damage, heart problems, and even a risk of certain cancers. But what about the less visible impacts? The effects on mental health and cognitive functions? Here's a thought-provoking question. Could steroid use be linked to diminished emotional recognition skills? Can it affect your ability to read other people's emotions, especially those of anger and disgust? This might sound like a plot from a science fiction novel, but recent research suggests this could be a reality. What if steroid use could affect your ability to recognize emotions? Let's dive in and explore this intriguing possibility. A recent study published in the journal Psychopharmacology has shed some light on this very question. Researchers aim to delve deeper into the effects of anabolic-androgenic steroids, synthetic variations of the male hormone testosterone, on emotional recognition. These substances, popular among athletes and bodybuilders for their performance and muscle mass enhancing abilities, are also associated with a slew of potential side effects. These range from physical to mental health impacts, including significant alterations in cognitive functions. Previous studies have linked anabolic-androgenic steroid use with heightened aggression, anxiety, depression, and even personality disorders. Interestingly enough, these behavioral shifts might stem from impaired social cognitive functions, such as the ability to recognize and interpret others' emotions. This skill is a cornerstone of effective nonverbal communication and empathy. The researchers of this study were particularly interested in the specific impact of anabolic-androgenic steroids on emotional recognition. They hypothesized that steroid use would correlate with reduced accuracy in recognizing emotions, possibly due to altered hormone levels. The study's lead author, Morgan Scarth, a postdoctoral researcher at Oslo University Hospital, explained their motivation. Our team has previously investigated the role of anabolic steroids in recognizing emotions from biological movement and theory of mind video tasks. We wanted to understand how people who use or have used steroids recognize emotions from facial expressions. We were also curious to see if fluctuations in hormone levels could explain any differences in emotional recognition abilities. The ability to recognize and respond to other people's emotions may have implications for social behaviors. The study involved 171 adult men, all of whom were engaged in heavy resistance training. They were divided into two main groups: those who had used anabolic-androgenic steroids and a control group with no history of steroid use. The steroid group was further categorized based on current usage status into those currently using steroids and those who had ceased use. Participants underwent a comprehensive evaluation including emotional recognition tasks, hormone level measurements, and assessments for anabolic-androgenic steroid dependence. Emotional recognition was tested using a computerized task where participants identified emotions from facial expressions. Hormone levels were analyzed from blood samples, focusing on the serum free testosterone index among others. The results of the study were both intriguing and alarming. The study found that men currently using anabolic-androgenic steroids struggled to accurately recognize certain emotions. In particular, these men had a noticeably harder time identifying expressions of anger and disgust. This isn't a minor footnote in the grand scheme of things. It's a significant finding that sheds light on how these substances may affect emotional recognition skills. The research team conducted a comprehensive evaluation of the participants, which included emotional recognition tasks and hormone level measurements. One of these tasks was a computerized test where the participants needed to identify emotions from facial expressions. The results were striking. Men who were actively using anabolic-androgenic steroids demonstrated a significantly lower ability to accurately recognize facial expressions of anger and disgust. But why might this be the case? Well, the researchers proposed that altered hormone levels due to steroid use could be a potential reason for this diminished emotional recognition. Testosterone, the hormone that these steroids are mimicking, plays an important role in our emotional responses. So it's plausible that fluctuations in hormone levels caused by steroid use could impact our ability to recognize and interpret emotions accurately. Another interesting facet of the study was the differentiation made between those currently using steroids and those who had ceased use. The latter group, although they had used steroids in the past, didn't show the same level of impairment in recognizing anger and disgust. This suggests that these effects might not be permanent and could potentially be reversed once steroid use is discontinued. What's more, the study also found that individuals with a dependence on steroids had a worse recognition of fear compared to those without such dependence. This indicates that the effects of steroid use on emotional recognition might be more pronounced in those who develop a dependence on these substances. The implications of these findings are far-reaching, especially when it comes to social interactions. Recognizing emotions is a fundamental aspect of human communication. If steroid use impairs this ability, it could potentially lead to misunderstandings, conflicts, and even social isolation. So as we delve deeper into the world of anabolic-androgenic steroids, we must remain mindful of these potential psychological effects. But that's not all. The study also found a correlation between steroid dependence and impaired emotional recognition. Now let's delve a bit deeper into this aspect. Steroid dependence was found to significantly impair the recognition of fear among the study participants. This finding was one of the more unexpected results of the study, and it suggests that steroid dependence may have even more profound effects on emotional recognition than simple steroid use. To put it in perspective, let's talk about fear. Fear is a primal emotion, a fundamental part of our survival instinct. Recognizing fear in others is crucial for understanding potential threats in our environment and for empathizing with others in distressing situations. However, the study showed that men with steroid dependence struggled to correctly identify this emotion, which could potentially hinder their social interactions and even their ability to respond appropriately in situations of danger. But why does this happen? Well, the study didn't pinpoint the exact causes, but it suggests that changes in hormone levels, specifically testosterone, could be a key factor. As we mentioned earlier, anabolic-androgenic steroids are synthetic variations of testosterone. When an individual becomes dependent on these substances, their natural hormone balance is disrupted, which could potentially affect emotional processing and recognition. However, it's important to note that this study is one of the first to explore the link between steroid dependence and emotional recognition. There's still a lot we don't know, and further research is needed to fully understand the mechanisms at play. It's also worth highlighting that the findings of this study don't mean that everyone who uses steroids, or even those who are dependent on them, will necessarily have impaired emotional recognition. These are potential risks, not certainties, and individual responses can vary widely. So in conclusion, the study suggests that steroid use can impair emotional recognition, with potentially more severe effects in individuals who develop a dependence. But as always, more research is needed to confirm these findings and to explore the underlying causes. So not only does steroid use affect emotional recognition, but developing a dependence can further exacerbate these effects. So what does all this mean for fitness enthusiasts who might be considering or are currently using steroids? It's a question that requires a closer look at the broader implications of the study. We know that the use of anabolic-androgenic steroids is popular among those seeking to enhance physical performance and muscle mass, but the potential side effects are far-reaching, extending to mental health and cognitive functions. The research we've discussed today adds another layer to our understanding, suggesting that steroid use could impact the crucial social cognitive function of accurately recognizing and interpreting others' emotions. Imagine the implications of this for social behaviors. The ability to read and respond to emotions in others is fundamental to our interactions. It's the bedrock of empathy, the glue that holds our social fabric together. If steroid use impairs this ability, it could potentially lead to misunderstandings, conflict, and strained relationships. From a mental health perspective, the inability to accurately interpret emotions, especially negative ones like anger and disgust, could exacerbate feelings of anxiety and depression, already known side effects of steroid use. It's a vicious cycle that could have serious implications for overall well-being. Interestingly, the study also indicated that those with steroid dependence showed worse recognition of fear compared to those without such dependence. It's a sobering thought, suggesting that dependence on these substances might not only affect physical health, but also the very way we perceive and react to the world around us. The bottom line is that while the physical benefits of steroids might be tempting for some, the potential costs are significant and far-reaching. It's not just about the possible physical side effects. It's about the potential impact on our mental health, cognitive abilities, and even our social interactions. In the end, it seems that the costs of steroid use extend far beyond the physical, potentially affecting our very ability to connect with and understand others. A strong body should never come at the expense of a strong mind.